Derita, derita, derita. Stop, stop, stop. Okay, okay. Hop, 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 hop. No le mueva. Asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in this video today, I'm going to discuss how do I study for exams during didactic year. So for those of you who are about to start PA school, who just got accepted into PA school or are in PA school or even interested in the PA career, I will be discussing just some tips that I recommend for studying in PA school, specifically didactic year. Now, didactic year is probably one of the most difficult years in comparison to clinical year. The reason why is because you're learning a lot of information in such a short period of time. And then on top of that, you're having a lot of exams. So you're having sometimes exam week after week after week. I know there was days where I would have 4 exams on one day, and then I would have the day off, and then the following day I had another exam. So time management is really important when it comes during didactic year. So how do I study for exams? I start studying the first day when the module begins. Now, what are modules? So in PA school, in my experience, this is now my experience in comparison to my school, modules are basically whatever system you're going through throughout the year. So for example, my first semester, we did the immunology/hematology module. That was our first module. And then our second module was the respiratory system module. Our third module was a cardiovascular module. And then our last module was a neuro module. So first semester I thought was really hard. I really struggled with cardiology and neurology. It was really, really hard for me. So that's what basically what a module is. Your semester is divided into modules. So for example, for my cardiovascular module, during that module you're learning about cardiovascular diseases, how to treat them, the pathology. So you have your core classes, which are your clinical medicine, which is one of the core classes, where you learn how to diagnose the disease, how to treat it, what disease it is, what orders or studies to order for the disease, and what preventative measures you can do. So for example, coronary artery disease, heart attack, etc. What preventative measures can you do to prevent the patient from suffering from a heart attack? Or if they have history of coronary artery disease, what can you do to prevent them from developing this? So this is our clinical medicine class. And then you have your pathology. So what is the pathology? What's the science behind coronary artery disease? What's happening in the heart? How does the heart function? What is the physiology? And then you have your pharmacology class, which is what are you giving the patients that have problems with their heart, like that have coronary artery disease? What medications are you giving them? What is their mode of action? What is your black box warnings? So who do you not give the medications to? What do you have to be careful with the medications? What are the side effects, etc.? So this is what a module is. So for each module in my semester, you're learning about the specific disease, etc. So I study once a module starts. So say I just finished my immunology and hematology module, and my next module is going to be the respiratory module, and my respiratory module is going to be 4 weeks. So for 4 weeks, we're only going to be going over the respiratory system, which is, once again, the pathophysiology, pharmacology, clinical medicine, etc. So you're going for those 4 weeks only over the cardiovascular diseases, right? And so during those 4 weeks, from the first day that we start, you start running because you just finished your exam, say on Monday. I just finished my exam on Monday for my previous module. Well, Tuesday you start your next module. So you really don't have a break in between. You start running, literally. Like right when you finish one exam, you go on to the next one module. So I start studying from that day, so that first day. I usually will take that, say I had exams that Monday, I'll take that Monday afternoon and I'll catch up on sleep if I have to. I'll go out with classmates, get some drinks. But yeah, so I just recuperate, and then Tuesday I start hitting it again. So I'll start hitting the books. So from day 1 of the module, I start studying for the exam, and I start preparing as if it was exam time, because I've learned that cramming does not work for me. Cramming can work for other individuals, but for me, it just hasn't worked, and I learned this the hard way my first semester. So I'm having to keep up with the information every day. So one of the things that I recommend and I always say in all my videos is repetition. You want to repeat the information every day, whether it's in flashcards, whether it's rereading the information all over again. Repetition is really important because in a module that is 4 weeks long, like for example, cardiovascular or cardio, you learn a certain disease. Say you learn about coronary artery disease day 1. Well, when it comes down to day 30, it's been 29 days since you learned about coronary artery disease. So if you did not keep up with it, if you did not repeat that information, the pathophysiology, the diagnosis, what labs to order, the treatment, if you did not keep up with that those days, then you're going to forget the information by the time it comes down to day 29. So that's why it's important to repeat the information, and that's why I start studying from day 1 when the information is being taught. And then I start adding to that. So day 1, we learned about coronary artery disease. Day 2, say you learn about DVTs, right? Which are the deep vein thrombosis. And then day 3, you learn about myocardial infarctions, which are the heart attacks, MIs. Day 4, you're adding progressively to everything. So what I do is day 1, coronary disease. Okay, day 2, I study what I learned day 1 and day 2. Day 3, I study what I learned day 1, day 2, and day 3. And then after that, you keep adding. And what you see is that the more you repeat, the faster you're going through the information because it's already learned. So for my flashcards, of course, the first few days, it's taking me about 3 hours to go through all of them. And then by the time day 28 comes, I'm going through them like fast. I can go through 200 flashcards in about 15 minutes or less. So that's why repetition is the key, and that's why I start studying from day 1 that the module starts. And I start studying for everything. Time management is important. You want to make sure you give appropriate time to this class, to this class, to this class, and not give more time to this class because this class is worth more, or you like this class more, or I don't like pharmacology, so bye, Felicia. So that's why you want to make sure that you give appropriate time to everything, and that's what I make sure I do every day. And I start studying from day 1. So yeah, that's how basically I study for exams. Now, when it comes down to exam time, so say that Monday I have exams, Friday, Saturday, and Sunday are usually days that I study all day. And I know it's really, really crappy, and I'll be at Starbucks or at some coffee shop, like drinking it up from like 6 a.m. in the morning to sometimes midnight, and I'm just like drinking coffee, drinking coffee. So I can stay up because you're just exhausted by the time it comes down. So during those days, I do study a lot. So I'll study sometimes, like I said, 6 a.m. to 12 a.m. I will take breaks in between to go get something to eat, but most of the time I'm just studying. Now, what I have noticed is by the time it gets to 8 p.m., I am just so tired that most of the information just doesn't stick. So by 8, I usually do practice questions. So I really, really recommend practice questions. That way you can test yourself and see what you know and what you don't know. So things that you don't know, you can focus more information on. Also, another thing that I found out is that I'm a morning person, so you want to make sure that you know whether you're a morning person or a night person. Some of my classmates are night persons, so they study more better. I would say I'm trying to use big words, sorry guys. They study better at night, and that's why night works better for them. Versus me, I study better in the morning. So at 6 a.m. when I wake up, my mind is fresh and I feel like I grasp more information. So at 6 a.m. I'll go over subjects that I have trouble with. So pharmacology, I'll go over pharmacology because pharmacology has always been a struggle for me, and anatomy. So at 6 a.m. I'll go over those classes because I feel like they're a lot fresher. And I'm able to grasp the information better. Because if I leave those classes to 8 or 7 p.m. when I'm already brain dead from studying all day, I'm not going to grasp as much information than if I study it during the morning because I'm a morning person. So that's another thing that I recommend is that if you are a morning person, is to study the information that you feel like you have trouble with or you don't grasp as good as other classes. Study that in the mornings, that way you can grasp it. And then by the time you start getting branded, like at 6 or 8, start doing questions. I paid for Osmosis, so I do their Osmosis questions. Smarty Pants has really good questions to test yourself because these questions mirror the exams that you will see for PA school, and also exam. I will put the name on here because I forgot, but there's also another resource. My program actually pays for it, so I don't have to pay for it. So I also test myself using that. So yeah, it's basically how I study. I study starting from day 1, from when the module starts. I will go to class from 8 to 4, 8 to 5, depending on what day it is. And from 5 to 10 or 11, I'll study. And I'll just go over the information that was taught in class. And then I'll go to sleep and repeat the same thing. I try to get enough sleep. But usually when it comes down to exam time, I don't get as much sleep. But the day before exams, I make sure I go to sleep at 10 or 9 p.m. because I've noticed that if I sleep, I grasp more information and I'm more fresher. Because in the mornings when I take the exam, because I usually have my exams in the morning, like at 8 a.m., and specifically if I have 4 exams that day, I'm there from 8 to 2, and I'm just taking exams. So you want to make sure that you're sleeping. And when you sleep, you grasp more information. I'm going through the exams, and I'm actually analyzing and critically thinking about the questions. Versus if you're running on no sleep, then it's a lot harder. I found myself that the times that I did not sleep, these were the mistakes that I made once again. My first semester that I learned from is that I was not reading the questions thoroughly. And I remember by the time I would get out of class, my classmates would ask me, hey, do you remember the answer to this question, X, Y, and Z? And I was like, I don't remember that question. And that was because I probably just did not read the question appropriately. And this really reflected because I got bad grades. And I knew the information, but I was just sleep deprived. So that's why sleep before the exam is really, really important, guys. I mean, you guys don't have to go to sleep at 9 p.m. like me or 10 p.m., but try not to push it to 2 a.m. or 1 a.m., 12 a.m. Make sure you go to sleep early. One of the good examples that my professors made is that an athlete who's running is practicing every day, but obviously the day before they're going to have their race, they're not running a lot. They need to make sure that they rest so they perform up to par the next day. And that's the same thing with exams, with your brain. You want to make sure your brain is rested and well that way the next day it can perform. So yeah, that's just basically how I study. I study a lot and I study all the time. If you ask my classmates, they think I'm a nerd, and I am a nerd. I'm a proud nerd. So yeah, that is just my experience and how I study for exams. So I hope this helped you guys, for those of you who are in didactic year. And as always, if you have any questions for me, make sure you comment below. And if you guys like my videos, make sure you give me some thumbs up. As always, thanks for watching my videos, and I'll talk to you guys later.